how important is it to test hormone levels? And I think we're talking about, you know, the estrogens, the testosterones, things like that. How important is it to test? And what do those tests determine if, you know, you don't get tested until you're 40 years old? How do you know what's normal for that person?
Right. Well, when you test a patient, it depends on who you ask. Some people argue that everyone should be tested as early as possible, especially in women, because hormonally speaking, things start to trend southward at the age of 25, technically. And so, it really depends on why you're testing them. So if you have a patient who comes to see you and they have specific issues, is it mandatory to test all of their hormones? Not necessarily, but it's important in so much as all of the hormones are interconnected and interrelated. So for instance, a menopausal woman has a higher risk of having low cortisol. There's an association there. A woman is more likely to have cortisol abnormalities than is a man. And male hormones and female hormones affect cortisol hormones. So there's a broad interrelation